Welcome to the Batch and BACAF Improving Services series and this module on delivering a net zero NHS through tackling climate change. October the 1st, 2020 may well become remembered as the second most significant date in NHS history after the 5th of July 1948, since it recognises climate change as a health issue and signals a commitment to become net zero over the next 25 years. This module will briefly introduce climate change and the potential health consequences, then go on to examine the content and implementation of the Delivering a Net Zero NHS report. Finally, it will cover implications for clinicians and paediatric and child health departments at both a personal and health system level. In this slide, on the vertical axis we have parts per million of carbon dioxide, and on the horizontal axis, years before today, from 0 on the right back 400,000 years on the left. You will notice cyclical variations in CO2 spanning 180 to 240 parts per million over the history of time, with a steep increase in the last 100 years. The fact to remember here is that we've used more energy in the last 100 years than the human race has used throughout its history. The horizontal line at 300 parts per million carbon dioxide is approximately the level we need to return to. The bottom line message is that climate change is real. The problem motivating action is it is difficult to visualize the future. But what we need to do is to take today's decisions for tomorrow's children. What is easier to see and experience is air pollution and extreme weather events, so it is often better to talk about reducing air pollution than reducing invisible climate change gases. The phrase clean and green, representing the short and long-term actions to reduce fossil fuel consumption, is possibly a better soundbite than tackling climate change. What air pollution and climate change have in common is human activity, energy use and food production. Having said that, the mechanism of action of pollution on human health in the short term is very different from the mechanism of action of climate change. Having said that, many of the interventions to improve air quality and reduce climate change are very similar. On this slide we have climate change on the horizontal axis and air quality on the vertical axis. The diagonal line, particularly at the upper right quadrant, highlights the beneficial interventions for both air quality and climate change, which includes energy efficiency and renewable resources, low emission power and transport systems, and potentially carbon capture. I can probably not explain the impact of climate change on human health better than the Lancet Commission, which outlined the impact of climate change on future generations. The life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated interventions, this new era will come to define the health of the people at every stage of their lives. Today I will not attempt to describe the interactions between climate change gases and various elements of our ecosystem and the consequences for human health, other than saying there will be direct and indirect effect. Direct effects will include nutrition, mental health, infectious and non-communicable disease. Indirect effects include extremes of weather, erosion of coastal areas, mass migration, potentially violent conflict, and a negative impact on many health determinants, including poverty. I apologise for the slightly contrived slide here. What I was trying to illustrate is that to tackle climate change effectively, many different interests, disciplines and expertise must come together. Examples would include material engineers enabling plastics to be broken down from polymers to monomers and then recycled, politicians to decide on taxation structures to reduce consumption of natural resources, biologists to regenerate the natural environment and to improve soils and food production, and energy engineers to create renewable sources. The list goes on. We live in an increasingly siloed world of increasing specialisation, but climate change mitigation requires collaboration from many different sources, looking at whole systems wider than just the biological carbon cycle. I would like to pause here for a moment and ask you to think about the solutions for climate change. Most of us think microscopically simply because we concentrate on disease within the human body. But climate change solutions forces us to think about the impact of human activity on a more global scale. After 3 minutes, please click to continue. All of these would be correct, but the overall impact is determined by how different issues interact. Food, for example. Improving the biodiversity of soil improves food production. Less food waste increases the availability of food. Closer food production reduces transportation, and recycling food waste into biodigesters creates energy, which just demonstrates the complexity of issues and the need to take a whole systems approach. But you might be surprised at the results of taking an evidence-based approach. If there is just one immediate thing you do after this mini-module, it should be to visit the Project Drawdown website. Project Drawdown examines all the possible actions to reduce climate change from the perspective of both evidence and action, and makes projections about the likely impact. At times the results are surprising. If we look at the left-hand bar chart here, light blue relates to materials, dark blue to food production, red to energy, and green to land use. Top of the list is refrigeration, simply because CFCs and CHCs are between 100 and 1,000 times more toxic than CO2 is to the environment. We tend to forget how much refrigeration is used in both air conditioners and food transportation and storage. Just look at the aisles of your local supermarket. The next surprise would be the combination of educating girls and family planning, which when taken both together have a greater impact than even refrigeration. Educating people to think about sustainability and enable them to choose when to have children is a major contribution to sustainable development. Unsurprisingly, the dark blue elements from the food chain contribute even more to climate change. Now let's start talking about delivering a net zero NHS. First of all, what does net zero mean? Net zero means that the UK's total greenhouse gas emissions would be equal to or less than the emissions simultaneously removed from the environment. So net zero is a balanced measure achieved by a combination of emission reduction and emission removal. Overall, the UK target is to be net zero by 2050. In 2017, the UK emitted a total of 460 million tonnes of carbon dioxide equivalent, and over the same period the NHS carbon footprint in England was 22 million tonnes of carbon dioxide equivalents, which is approximately 4 or 5% of the total. As it is unlikely that all sources of greenhouse gas emissions can be eliminated, there will need to be some form of carbon capture and storage. And again, in 2017, it's estimated that 28 million tonnes of carbon dioxide were removed by vegetation in the UK. To put this in some form of clinical context, 1 year of kidney dialysis is equivalent to 7 return flights from London to New York, and the carbon emissions of the NHS are greater than all the flights leaving Heathrow annually. Before we start, we need to have a conversation about greenhouse gas protocols, otherwise known as GHGPs, to decide what is included and what is excluded from the equation of net zero. Greenhouse gas protocols exist in order to try and allocate responsibility for greenhouse gases and to be able to compare either organisations or parts of organisations. Personally, I think they can be confusing when applied to the NHS, but they are used in the Delivering Net Zero plan, so I need to cover them here. Greenhouse gas protocols are in 3 parts, or scopes: Scope 1, 2 and 3. Scope 1 covers the climate impact directly related to the organisation, for example, use of energy or fuel. Scope 2 covers the indirect energy use, for example, the climate change gases created in the production of electricity. Finally, Scope 3 is basically everything else, all the consumables, the transport of consumables, and all the waste that is not recycled. There are many different pictorial representations of the three scopes of greenhouse gas protocols. I quite like this one because it shows the magnitude of Scope 3 in comparison to Scopes 1 and 2. For those of you who don't know the meaning of fugitive emissions, it means the escape of gases or vapours from pressurised equipment. This is the diagram that appears in Delivering a Net Zero NHS. On the left-hand side, with a white background, is the NHS carbon footprint. On the right-hand side is the NHS carbon footprint plus, and as you can see, parts of the Scope 3 are in both the carbon footprint and the carbon footprint plus. Travel is normally excluded from Scope 3, but is included in the carbon footprint plus. I find this diagram more helpful. Everything in green is the NHS carbon footprint, and everything in blue is the NHS carbon footprint plus. When examining charts and figures, it's essential to understand what is being measured and what it relates to. The obvious examples would be health and social care, just the NHS, or just hospital care, or just acute care. This diagram includes the NHS, public health and social care, and the top three footprints are from energy used in buildings, travel, and commissioned health and care services. This time we have the NHS carbon footprint, where the largest footprint comes from pharmaceuticals, followed by medical equipment, followed by energy use and commissioned services outside the NHS. Finally, we have NHS procurement, where again pharmaceuticals and surgical equipment are the dominant elements. Just to mention here, unused prescription medicines cost the NHS at least 300 million a year in England, and of this 150 million are considered avoidable. So just to recap, GHGP Scope 1 is all the direct climate emissions produced on site. GHGP Scope 2 are all the emissions generated from purchased goods and energy, and GHGP 3 are all the indirect emissions that occur in the producing and transporting of goods and services. My confusion arises because of the ambiguity between purchased goods and energy and producing and transporting goods. However, having clarity about the various elements is more important than a semantic debate about categories. The NHS Net Zero document describes 8 steps to decarbonise. Central to the plan is to develop new models of care, and this overlaps with the NHS long-term plan, and I will be spending more time on this simply because it involves changes in clinical care. Reducing emissions from pharmaceuticals and the NHS supply chain, together with net zero travel and vehicles, are basically no-brainers. We are in the early stages of a digital transformation following the COVID pandemic, and while digital consultations might be more efficient, I do worry that they might be less effective, particularly for complex conditions. We are at the beginning of an exponential digital curve, and it's difficult to predict the benefits and potential harms of this digital explosion over the next 2 decades. Immersive technology refers to technology that emulates a physical world through the means of a digital or simulated world, which could be used during training. Digital therapeutics is described as the delivery of evidence-based therapeutic programs to patients by high-quality software programs to prevent, manage or treat a medical disorder or disease. There is a huge amount of work to upgrade existing health accommodation to make it net zero and energy efficient, and it will be interesting to see what form these 40 new net zero hospitals will take. Mitigation, adaptation and resilience across all parts of the NHS will be essential to effectively tackle NHS climate change, and many different groups may need to find different ways of working together. This is a 20-year plan which will require strategic leadership in every trust, at every level, in every corner of the NHS, with a relentless commitment to quality improvement and meaningful measures to monitor the effect of interventions. Now let's examine Chapter 4, which has a number of subsections that I've summarised here. One important point that is not highlighted particularly in the paper is the potential influence of the Delivering Net Zero agenda on the 1.4 million NHS employees, and potentially far more than this if we include all the organisations with integrated health systems. Most of the recommendations are what I would call common sense and are equally applicable at home as they are to work. I will very quickly summarise the content of these subsections in order to concentrate more time on the meaning and implications of sustainable models of care, which to a large degree overlaps with the NHS long-term plan. Starting with estates and facilities, because energy use accounts for about 20% of the NHS carbon footprint and is relatively easy to tackle. The building upgrades I've mentioned before, but there is a huge potential for solar generation of electricity on NHS sites, and the intention is to become 100% renewable by April 2021. Some primary care accommodation will be difficult to upgrade, and I would recommend the Green Impact for Health toolkit produced by the RCGP. There is also the opportunity to increase NHS green space, both for carbon capture and for improving the environment for staff, patients and local residents. Anaesthetic gases account for about 2% of the NHS carbon footprint, simply because many are extremely potent climate change gases. Unintended gas release is quite common when changing bottles, and there is interesting work being undertaken to reduce the impact of anaesthetic gases. A staggering 9.5 billion miles is travelled by patients and visitors, staff and suppliers of the NHS, which accounts for 3.5% of all road travel in England. Obviously car sharing, improved public transport, active travel particularly for NHS staff, who on average live 3.5 miles from their work, and the electrification of the UK supplies fleet are all essential. Provision of health services closer to home and investment in primary care and community services as envisaged in the NHS long-term plan could have a significant impact on patient travel. £20 million is spent on pharmaceuticals each year, which is just under a fifth of the total NHS budget. This area is probably going to be the most challenging element to reach net zero, when you consider everything from production costs, transportation to pharmacies, and then distribution to patients. While suppliers are responsible for decarbonising their own processes, some of these responsibilities transfer to the NHS. The second largest carbon footprint in the supply chain is for surgical services, as many of these elements are single-use, difficult to dispose of due to contamination, requiring sterilisation and highly specialised. Since the NHS is such a massive organisation, the procurement chains are multiple and complex and will require some innovative thinking to significantly reduce their carbon footprints. Overall, medicines contribute about 25% to the total NHS carbon footprint. I've already mentioned anaesthetic gases, but other clinically relevant interventions would include changing to dry powder inhalers rather than metered dose inhalers which contain fluorinated hydrocarbons, programs to return and recycle metered dose inhalers, and reducing unnecessary polypharmacy. There is a huge opportunity for the NHS to lead by example, to act as an anchor organisation within the local community and encourage local sourcing of foods, the use of seasonal produce and an increasingly vegetarian diet. New national standards for healthcare food are proposed, coupled with the Eat Well programme, both for health and reducing obesity. I have included this chart simply to remind people of the carbon footprints of different forms of food. We all know that red meat is carbon intensive, but it's easy to forget milk, butter and cheese. Some 30% of all crops are fed to animals, and it takes about 20 vegetable calories to create 1 meat calorie. We don't have time to discuss land degradation due to farming or the environmental effects of fertiliser, except to say that they all contribute to climate change. The other often neglected element that supports the NHS is the research and innovation agenda. The intention is to embed sustainability into all decision-making processes and net zero to become an integral part of the research strategy for academic health science networks and accelerated access collaboratives. Sustainable models of care are the central part of the Delivering Net Zero paper for clinicians, and there is a huge overlap with the NHS long-term plan, which also talks about new models of care. I would like to refer you to the Batch and BACAF websites for the Improving Services series, which include a series of papers and PowerPoint webinars which cover all the essential elements of the long-term plan. The new service model is based on improving patient journeys through services. Pathway thinking then brings all the elements together to ensure safe and effective care that is also best value. Explained simply, it means all the parts are in place and working well together, linked to a system of measurement and continuous improvement. This should enable earlier recognition and assessment and access to care closer to home to avoid unnecessary hospital visits. For those people with a long-term condition, personal participation in the production of proactive care plans which cover both treatment and tackling health determinants should enable better condition management and also the prevention of comorbidities. The second major theme for sustainable models of care is a relentless focus on prevention. This requires a life course approach to tackle both lifestyles and health determinants, to protect individuals against health hazards that may cause harm, and promote health assets which create resilience and well-being. Tackling health determinants should be part of both individual care plans, and the expectation is that the NHS gets more involved with population health management to promote the health of groups of patients, as well as reducing variations in outcomes and tackling inequalities. Critical to new models of care is system leadership, networks and workforce development. System leadership requires individuals with vision, the ability to communicate and get the best out of people. Networks require a high level of trust and collaboration between the individuals and teams that provide the component parts of the pathway. Organisations of the future must have a culture of learning, perpetually innovating and spreading what works best to create an environment in which the workforce thrives. Looking after the workforce, enabling them to work to full capacity, is all part of climate change mitigation. Finally, we come to funding and financial mechanisms to embed new ways of working. Accurately estimating the NHS carbon footprint through the Greener NHS dashboard is just one part of the data and information agenda. Being able to assess new ways of working, particularly in clinical programs of care, in ways that allow comparison between different services and support quality improvement, once again are all essential elements to the climate change mitigation strategies. The Delivering Net Zero NHS paper models a number of scenarios which are illustrated in charts similar to this one. I include it here to illustrate the concept of policy wedges. Policy wedges map onto the greenhouse gas protocols mentioned earlier, so that there will be separate wedges for, say, energy use, transport, procurement and new ways of working. In this diagram, the purple represents the NHS carbon footprint if there were no effective policies, while underneath in the green wedges are the accumulating benefits of multiple policy interventions over the next 20 years to achieve net zero by 2035. Delivering Net Zero report also contains a number of tables that allow you to quickly identify within your sector the areas that have largest and smallest carbon footprints. So looking at the acute sector here, the two largest green circles represent electricity and gas, and the large yellow circle, service user travel. At this stage it is difficult to foresee how well all the climate change mitigation policies will work together, so an iterative and adaptive process is proposed. There will be an international advisory committee to learn from overseas, and England will have an NHS Improvement Sustainability Board to oversee progress, and the NHS Sustainable Development Unit will morph into the Greener NHS National Programme. Regular reports covering the health and social care sector will be produced, and the whole topic of health service and climate change will be included in the COP26 Climate Change Conference hosted next year. Now let me summarise the key points that contribute to sustainable healthcare and reducing climate change gas emissions. The first point is to reduce demand on the health service by promoting well-being and protecting individuals from hazards that have the potential to cause harm. The second point is the best management of clinical conditions to prevent the development of secondary comorbidities. The third point is to design services based on pathways to ensure all the parts are in place and working well together from the perspective of a patient journey. Fourthly, we need to recognise that resources are not unlimited and therefore some difficult choices need to be made, but health equity is equally important to GTP when making political choices. Not least, we must embrace low carbon technologies and reduce waste in the system. There is mounting interest in the concept of a Green New Deal, which started in 2008 but has gained momentum during the COVID pandemic, which has also recognised the inequitable impact of COVID on the most vulnerable groups in society and the need to build back better in the future. The 5 main strands are to decarbonise the UK and in the process create secure new jobs. Next is to transform the economy to reduce poverty and protect the environment. And finally, the theme is to promote global justice, meaning to reduce the differences of wealth and health between nations and protect future generations. I want to give the last words of this presentation to the children of today who represent the interests of the children of tomorrow. First, climate change is for real, and that it is an unintended consequence of a free market economy that does not value people or the planet when pricing goods or services. So the system must change if climate improvements are to follow. Then we must value our natural environments, since perpetual growth based on using natural resources is simply not feasible on this finite planet. I will leave this slide up for you to think about.